Hello again. I'm Dr. Tom Goyne of Aberdeen Audiology, offices in Wayne, Malvern, and Westchester here in the Philadelphia suburbs. Thanks for joining us again. For most of these videos, I'm often joined by a colleague of mine, a fellow doctor of audiology at Aberdeen Audiology. But for this video, we're going to change things up a little bit, and I'm going to share the space with a patient here at Aberdeen Audiology. He'll join us in just a minute. Uh, we're going to talk about the benefits that he experienced from auditory training. Now, what is auditory training? Before we bring him in, let's explain what it is. First, auditory training is a great tool that we have to improve somebody's ability to understand speech better and remember speech better. Processing speech actually requires a significant amount of brain power. Some folks have auditory processing issues where their hearing is fine and they have difficulty understanding speech. But most people, they have hearing loss, and that hearing loss brings with it some distortion. And as great as today's hearing aids are, and they are really great, there is a limit to what they can provide. They can't give someone 20/20 hearing, so to speak. And so auditory training can help bridge the gap between what hearing aids can provide and where this person would like their performance to be. And so we can take someone and their hearing aids, do auditory training, think of it as like physical therapy for the auditory system, just as in physical therapy, some exercises and some movements and some training improves upon your ability to, move your body and your strength and your coordination, your flexibility. Similarly, auditory training can help your brain process speech, remember speech in a variety of listening situations, quiet, competing noise, and that sort of thing. So it's a wonderful tool. Because it flies under the radar so much, hearing aids get a lot of attention, deservedly so. They're great. But auditory training is a great complement to, move the needle, advance the ball. Here we are in Eagles playoff season, so it's, we're looking to advance the ball, right? So without further ado, we'll bring in our patient, and I hope you learned something and enjoy the video. Thanks for taking the time to do this. If you wouldn't mind, just tell the folks watching, just give us your name and your occupation.
All right. Well, thanks, Dr. Goyne. My name's Danny Slame. I'm a family doctor, and I work in an extremely busy and loud command center.
Right.
So that is part of what brings us together with all the challenges with my hearing issues in the context of what I do with my life as well.
Right. And so if you don't mind sharing, you know, we've worked together for a little while. Before we embarked upon auditory training in the fall, we had worked with you to improve your hearing in a number of different ways. Do you mind sharing just a little bit what your hearing is like with and without hearing aids?
Absolutely. So yes, so we've been together for a really long time, and I think one of the probably unique characteristics about me as one of your patients is that whenever we did an audiogram, uh, the reported needs of the volume that I needed for my hearing aids, based on the audiogram, was always less than what I felt like I needed. And I
Right.
always, on every occasion, asked you to turn the volume higher than what it looked like the test was showing was required.
Hmm.
Um, so, so we've been doing this for a while, and really, without my hearing aids, I wouldn't hear anything from my left side, and I would barely hear anything from my right side. So when I'm sleeping and my hearing aids are out, I don't hear much at all.
Right. Right. And there's hearing there. It's just that, it is a pretty severe amount of hearing loss in both ears. And so to conduct a normal conversation without hearing aids would be essentially impossible.
That's right.
Yeah, if a loud alarm were to go off, you would hear that.
Mhm.
But just typical conversational speech would be pretty much impossible. And then I think it's pretty safe to say then that with hearing aids, your hearing is obviously drastically improved, but partially because of the severity of your hearing loss and partially because of the listening situations you get yourself into, both occupationally and personally,
Mhm.
it wasn't getting you where you wanted to go. Like, in other words, the hearing aids were extremely helpful, but you still wanted to move the needle a whole lot more. Is that a safe statement?
That's right. And I think where there was a lot of variability is what I think that you refer to as word discrimination. So um, so maybe I could hear a sound coming out of someone's mouth or out of a speaker or something, but I just might not be able to distinguish between the different letters or the sounds. And I'll just tell you that I met someone before I started the process that we're going to talk about today, in a parking lot, and I heard him introduce himself as either Jeb or Jed, and it turned out that his name was Ted. So it's a classic story of missing a letter on one side or the other of the word, and that impacting my ability to connect with people.
Right, right. And as I talk about all the time,
Mhm.
so many of the sounds of speech that we call phonemes, the individual sounds of speech are called phonemes, and words are made up of several phonemes. So many of these phonemes are acoustically incredibly similar. And so and it's usually the consonants that are most similar. So in the example you just gave, you got the vowel right, because the vowel is stronger and more resonant. So you got that right. But the more subtle consonant, that's where you were struggling. And it's because they are acoustically so similar and they come at you so fast. And so when you have hearing loss, even though hearing aids do a great job of helping, they don't always get people to where they want to go. And there's still some blanks to fill in. And sometimes those blanks come at you too fast. And so that's what brought us to auditory training. We
Mhm.
kind of got to a point where we had the best hearing aid technology. We maximized everything we could out of that, and you still didn't get to where you wanted to go. By the way, your hearing isn't to the point where even though it's a severe amount of hearing loss, you're not to the point where a cochlear implant makes sense. Your hearing is too good for a cochlear implant. So you're sort of in this gray area where hearing aids aren't tackling everything you need them to tackle, but on the other hand, you're not anywhere near ready for a cochlear implant yet. So there's where auditory training came into it. Auditory training, the way I describe it, is we are teaching the brain to make sense of speech and process speech quicker and faster and more accurately. In other words, in a patient like you, we're trying to get your brain doing better than average auditory processing in order to make up for the deficits coming from your ear and your hearing aids. And so, after some discussion, we talked about it a few times, but you embarked upon it. Um, what after you've gone through the 12 sessions and you feel like you're doing better, and we have some testing that shows you're doing better, but what's your opinion? What where in your world, where did you see improvement? What situations did you see improvement with auditory training?
Yeah, well, I'll start off by saying that you had suggested this to me a few times, and I sort of didn't believe it was going to help. But uh, at one point, you asked in a convincingly enough way, and I said, "All right, fine, let's just do this thing." And it turned out that maybe because I had low expectations, I'm not sure. I found that number one, I really enjoyed it, and I felt like right from the beginning that we were on the right path. There were 12 one-hour sessions that we did, and there was a range of one second. There's a range of exercises that we did, both distinguishing between uh, different sounds
Hmm.
and both so both perceiving sounds in a range of conditions, and also working on memory and just really paying attention using numbers and feedback and other what I thought actually were pretty fun exercises. And
Sure.
the conditions that changed were in part were increasing the background noise. So maybe I
Hmm.
would have to repeat something back and forth, or there would be words that would come and I'd have to uh, say the sound and the word, or give a list of numbers in a particular order. But then the background noise would simulate a loud restaurant, and maybe low, medium, and high. And I just kept practicing through the hour.
Hmm.
Um, and in short, I think the what it did for me is it made me realize that I can I can hear a lot more than I think I can, and I think in the past, uh, and this is understandable, I was giving up in a lot of situations. I just would be in a loud restaurant and I would think to myself, "There's no way I'm going to hear anything. I'm just going to tune out." That's
Yep.
it. Or someone would ask something, and I would just ask them to repeat themselves because it was just a lot of work to pick up what they were saying. But I realized in these 12 sessions that there are skills to distinguish, the different sounds that they're saying, and also to string together the words in a sentence.
Right.
Uh, there's work, but I think my confidence increased to do
Yeah.
that.
Yeah. Well, that's not a knock on your grit or your resilience. It's human nature. When something is just too difficult, bordering on impossible, we just sort of wave the white flag on it.
Mhm.
And, as an audiologist, I can sort of look around a difficult listening situation and I can tell who's able to follow along and who's not, just because, some folks you just kind of get to a point where it's a bridge too far and you just kind of give up. The example I give is, I'm all of 5'8". I can try as often as I want to dunk a basketball. It's not going to happen. So at some point, I just give up because it's not going to happen. And so, if it's a really difficult listening situation and you have a whole lot of hearing loss, then it's just human nature to try and give up. But so, and the other amazing thing still to me about all of this, and when I say all this, I mean auditory training, is just how well it works. You're right; these are skills. There are things that we can do to rewire the auditory system, to strengthen the auditory system. And it gets the brain recognizing those phonemes quicker, faster, and more accurately,
Mhm.
but then also allows you to remember better what you've heard. Because if you're struggling to understand what somebody's saying, you don't have a lot of cognitive resources. We don't, as humans, have a lot of cognitive resources left to really retain it. And so, if we're kind of a two-pronged attack on this thing in auditory training, where we're getting your brain recognizing the phonemes quicker, faster, more accurately, and we're increasing your memory so that you can remember better what you've heard, then you're just able to digest it better and you're able to retain it better. And whether it's, I hate to put words in your mouth, but whether it's an occupational thing, a professional thing, a social thing, a personal thing, a family thing, that's the whole point of having these conversations, is to interact with someone else, either to problem solve in the workplace or an enjoyable experience with the family at dinner or something, and be able to retain it and engage in it and be part of it. And so, for me, I'm just on my end, I'm still thrilled after 5 years of having this as a tool that we can actually improve people's ability to process speech. So,
Yep.
so you're right. It's typically it's 12 sessions, and typically we do them over Zoom, as you know. So you didn't have to figure out how to get into the office once a week for 12 weeks. We were able to do it if you were on the road or if you were at home or whatever.
Mhm.
Um, if you were, let's say, so at one point I was in the position of having to convince you to embark upon these 12 sessions. Let's say you were sitting down with somebody and saying, trying to persuade them to embark upon the 12 sessions. What sorts of things would you tell them?
Yeah, well, um, I have a feeling that so it was Dr. Bruce who did these 12 sessions with me, and I guess the number of reasons why I was hesitant to do this. One is I think of myself as a very busy person. I'm hard to nail down in a schedule, and doing this by Zoom, uh, and it allowed me to be more flexible with the timing and figure out times that worked. We did 12
Hmm.
sessions in 12 weeks. I don't think we missed 1 week.
Yeah.
Um, but the other thing is that the exercises I believe were somewhat tailored towards my needs. So
Yes.
by the end, there was some what seemed like pretty advanced exercises that were fun. I'll give an example of one of them, and maybe that'll show what I got out of it. Dr. Bruce would give six numbers, and then I would have to repeat those numbers backwards. And then we would do that over and over again for 20 times or 30 times. And then she would increase the background noise while we were doing it.
Hmm.
So if I'm going to remember the six numbers she gave me and repeat them backwards, I really need to pay attention. And I
Hmm.
can't just pay attention like for one round. I have to have sustained
Yeah.
focus. And it was hard to do at first, and then I started to get into a rhythm and figure it out.
Hmm.
And I guess that the one of the takeaway points is I used to dread going out to a restaurant and hearing all that background noise, lots of conversations, silverware clinking, vents laughing, all kinds of, and realizing thinking that I was going to have to fake my way through the conversation. And I sort of look at it as a good challenge now, where I'm going to go out and I think to myself, all right, let's do this, and use the skills that I gained in these practice sessions out in the real world. And I think
Yeah.
I'm picking up a lot more.
Yeah.
So maybe uh, knowing that I'm capable of doing it increased my confidence and kind of renewed my um, desire to try harder in those circumstances, which I
Yeah.
think is a large part of the success here.
Yeah. 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 A little bit of a whatever the opposite of a vicious circle is, where you're,
Mhm.
because you're improving, it gives you some confidence, which allows you to improve a little bit more, which gives you some more
Maybe
confidence.
a positive feedback loop.
Yeah, positive feedback. Yeah, that's a good
Yeah.
one. But your example there of the auditory recall exercise, um, she gave you six numbers. You had to repeat those. She had a background noise. If you had found that super difficult, she would have dropped down to four numbers. And
Yeah.
if you still found that difficult, she would have taken away the background noise. My point in all of this is, if there's somebody listening to this or watching this thinking, geez, I don't know if I can do six numbers and repeat them back with background noise. I don't know that I can do that. That's We don't do the same thing with everybody. We're tailored. We do somewhat the same exercises, but we tailor their difficulty based upon how well somebody's doing. And so, I'm always telling reminding folks that we want to make it challenging but doable. If it's too easy, you're not going to get anything out of it. If it's too hard, you're not going to get anything out of it. But if it's challenging but doable, which Dr. Bruce found the sweet spot for you, then you're going to improve. And the other amazing thing to me about all this is it sticks. So with the improvement you've experienced, it's not going to wear off. It's not like, well, we need to do, need to keep doing this weekly or you're going to lose it. I
Mhm.
like to draw a lot of analogies with physical therapy and that sort of thing, but here's where that falls apart is, with physical stuff, you have to keep doing it or you do atrophy. With this, whatever improvements you see, it sticks. It sticks.
Yeah.
So I appreciate you taking the time to do this. Anything else you want to add or anything like that?
I'd say uh, this is a good exercise. I recommend doing it for people who have some degree of hearing loss and challenges with hearing. It's important to not give up and to keep trying. You don't want to remove yourself from conversations because that's a slippery slope. And if you're not hearing your colleagues or your loved ones, then it may turn out that they subconsciously stop coming to talk with you as well about important things. So putting in the effort, I think, is really important for the long-term health of relationships as well. So
Yeah,
this is a good tool.
I would
So
agree with that. And you're right, it is subconscious. People don't really realize they're, making those alterations. But
mhm.
again, humans being what they are, that happens. Sure. Well, I appreciate you taking the time to do this. I hope folks find it helpful. And we will be seeing each other again, I'm sure.
All right, Dr. Goyne, thank you so much.
Thank you. Thank you to Dr. Slame for joining us on the video. If you or someone uh, think might be interested in auditory training, you're wondering if auditory training could benefit you, give us a call. Go to our website, aberdeenaudiology.com. You'll find the phone numbers to our offices in Wayne, Westchester, and Malvern. Give us a call. Come on in, and we'll see if we can help. And that goes for other things we do as well: tinnitus, balance issues, hearing issues, auditory processing issues, cochlear implants. If it's hearing, if it's balance, we can help. So hopefully you're finding these videos helpful. Let us know what we can do to help. Thank you.